Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Helios Cancer Clinic. So let me take this opportunity to talk to you all about an important cancer in females, which is endometrial cancer. Now, very often patients get confused between endometrial cancers and cervical cancers. Cervical cancer happens in the lower part of the uterus, in the part of the uterus known as the cervix, whereas endometrial cancer happens in the inner lining of the uterus known as the endometrium. It is an important cancer to understand about. The most common way of presentation of endometrial cancer is post-menopausal bleeding. So if a lady has attained menopause, which normally happens at the age of around 48 or 50 years in India, and later on she has spotting or reddish discharge, then it is a matter of concern and it has to be evaluated. So any such symptom of a postmenopausal bleeding needs to be taken seriously and evaluated properly. So what are the tests that are done? So apart from a gynecological examination, an ultrasound of the abdomen or a transvaginal ultrasound may be asked for. What we specifically look for in ultrasound is the endometrial thickness. How thick is the endometrium? In postmenopausal women, the endometrium shrinks. It's not supposed to be more than a few millimeters thick, whereas in certain situations like endometrial carcinoma, there may be quite a bit of thickening of the endometrial lining. So if such a thing is detected, then the next thing to do would be a biopsy. So how is this biopsy done? So biopsy is done in various ways. It can be an office procedure where a small instrument known as a pipple is inserted and a biopsy is taken. Or it may require a procedure in the operation theatre like a dilation and curettage, and sometimes a hysteroscopic guided biopsy is also done. So depending on the situation, we choose which type of biopsy is to be done. The biopsy is sent to the pathologist where they give a confirmation whether it is a endometrial cancer or not. We may not get a diagnosis in all the conditions, and in certain situations we have to work with a high degree of suspicion. The other important test when there is already a diagnosis of endometrial carcinoma would be an MRI of the pelvis and also the abdomen. We need to know how deep into the uterus the endometrial cancer is going, whether there are any enlarged lymph nodes, whether the lower portion of the uterus or the cervix is involved, because treatment might differ according to this. So once the biopsy is there and once the MRI is done, next we come to the treatment. Luckily for us, most endometrial cancers present in an early stage, and they are of the more favorable variety known as the endometrioid variety. Surgery forms the mainstay of the treatment in these cases. Now, it is not simple removal of the uterus and ovaries, which is done in most other cases. If just this type of surgery is done, we might miss out on vital information about the lymph nodes, which also helps us determine whether any further treatment is required. So it is important to remove the uterus, the ovaries, and also tackle the lymph nodes in endometrial cancer. The tackling of the lymph node can be done in various ways. The standard way in which it is done is a lymph node removal or dissection. Nowadays we have more advanced methods known as sentinel node biopsy, where we detect that which particular lymph node is draining the uterus and send it for test before deciding whether we need to go for a full lymph node dissection or not. There are a more aggressive type of endometrial cancers or the non-endometrioid variety in which a more extensive surgery may have to be done. After surgery, we have a look at the pathology report, see what factors are favorable and what factors are unfavorable. If there are some unfavorable factors, we may recommend the patient radiation and sometimes chemotherapy. Grade of the tumor or how similar it is to the original cell. This information is of paramount importance in endometrial cancers. Many treatments are recommended based on the grade of the tumor. Radiation, in very early cases, it might just be vaginal brachytherapy or radiation just to the vaginal vault, and in some cases the entire pelvis may have to be irradiated. When lymph nodes are positive or there is suspicion that the cancer cells may have escaped and gone elsewhere, we might recommend chemotherapy also. So, you need to know about endometrial cancers, especially about postmenopausal bleeding, and when this is appropriately treated, it's a highly curable cancer. Thank you.